Today's lecture will be about the ultrasound anatomy of the hip and thigh in adults. We start examination of the hip by the anterior approach, where we put the probe in LS position at the site of the head and neck of the femur. This is a diagram showing the uh, anterior recess of the hip joint, where the joint effusion is seen. This is the acetabulum, the femoral head, neck, and the shaft. This is by ultrasound, the femoral head, the neck, and the shaft of the femur. And this is the recess where we see joint effusion. The muscle in front of this recess is the iliopsoas muscle. Then if we just move the probe a bit upwards at this area, we can see part of the acetabulum, where this is we can see it here. This is part of the acetabulum, and this is the femoral head, and this is the triangular echogenic labrum. Then we examine the anterior inferior iliac spine, where there is the attachment of the direct tendon of the rectus femoris muscle. Usually we start the examination by starting from the muscle bulk down in the thigh, where we see the ovoid rectus femoris muscle, which is the superficial muscle. Below it are the vasti muscles. In the middle, we can see here the central aponeurosis of the muscle. Then we follow up the muscle upwards. We notice here that there is a decrease in the size of the muscle, and this is the myotendinous junction starting to appear. Then, after the disappearance of the rectus femoris muscle at upper levels, we see the tendon attaching into the anterior inferior iliac spine. The indirect tendon of the rectus femoris muscle is seen if we move the probe laterally at the lateral aspect of the acetabulum, where we can see the hypoechoic appearance of the indirect tendons of the rectus femoris, and this hypoechoic appearance is due to the anisotropy. Continuing with the anterior hip, if we extend the examination upwards to the right iliac fossa, here we can see the iliacus muscle, the lateral fibers, the medial fibers, and the iliopsoas muscle. Taking a cross-sectional image here, we see the lateral fibers of the iliacus, the medial fibers, the iliopsoas muscle, and the iliopsoas tendon. By ultrasound here, we see the lateral fibers of the iliacus, the medial fibers, the iliopsoas muscle, and the iliopsoas tendon. And this is the anterior inferior iliac spine with the direct tendon of the rectus femoris muscle. This is another image for the TS view, and we can just move the probe into an LS orientation where we can see the iliopsoas tendon. Then moving the probe TS at the level of anterior superior iliac spine, we see two muscles, one at the lateral aspect and the other is at the medial aspect. The one at the lateral aspect is the tensor fascia lata, while the one at the medial aspect is the sartorius muscle. Both have an attachment at the anterior superior iliac spine. If we move downwards with the bulk of the sartorius muscle, we can see here the nerve, which is the lateral femoral cutaneous nerve. Then we move the probe downwards to examine the thigh muscles. As mentioned before, putting the probe TS in the middle of the anterior thigh, we can see here the ovoid appearance of the rectus femoris muscle and its central aponeurosis. Beneath it are the vasti muscles. In the middle is the vastus intermedius muscle. Then, if we move the probe at the lateral aspect, we can see the vastus lateralis muscle. And this is the rectus femoris, and below it the vastus intermedius. While putting the probe at the medial aspect, here we see the vastus medialis muscle. By putting the probe at the most medial aspect of the thigh, we can see an ovoid superficial muscle, which is the gracilis. Then moving to the examination of the medial hip, the patient is preferable to be examined in frog leg position. We put the probe TS with slight oblique orientation parallel to the fibers of the adductors. Then we move the probe towards the symphysis pubis, where we see the adductor longus, adductor brevis, and adductor magnus muscles with the tendinous insertion at the symphysis at the pubic bone. We can use a deep probe to examine the deeper muscles in patients that are muscular or obese. Then if we put the probe at, above the pubic bone, center of it above the bone, and the head in the direction of the lower rectus abdominis muscle and its tail with the orientation of the abductors, we can see this view. This is the pubic bone, this is the rectus abdominis muscle, and this is the adductor muscles. And here we can see the common aponeurosis. This view is very important just to examine or to be examined in athletic patients to exclude athletic pubalgia. Then we put the probe in TS view. We can see the symphysis pubis, the pubic bones, and the lower rectus abdominis muscles if we slide the probe slightly upwards. Then we examine the lateral hip. On examination of lateral hip, we just put the probe over the greater trochanter in TS and LS orientation. In LS view, we can see the gluteus medius, then the gluteus minimus, and this is the tendinous insertion in the greater trochanter. Above them, we can see the iliotibial band. On TS view, we see the greater trochanter, which have an anterior facet and the lateral facet. The anterior facet is the site of attachment of the gluteus minimus tendon, while the lateral facet is the site of the insertion of the gluteus medius tendon. Also here we notice the iliotibial band. Then moving to the examination of the posterior hip and thigh. The examination starts at the ischial tuberosity. Then we move in a tuning fork orientation for the examination of the posterior thigh muscles, which are the hamstring muscles. Then starting from the hand now the handle of the tuning fork, we see the hamstring origin, which is the common tendon formed by the two muscles, which are the biceps femoris muscle and the semitendinosus muscle. We can also see the semimembranosus tendon and the sciatic nerve. Then if we move downwards towards the curvature of the tuning fork, at this level, we will see the Mercedes-Benz sign of the sciatic nerve, as well as the semimembranosus tendon. These are two important landmarks that can help us on to identify properly the hamstring muscles. At this level, we see the biceps femoris long head, semitendinosus muscle, and semimembranosus tendon as mentioned. After this point, we can either move at lateral aspect or medial aspect of the posterior thigh. On moving the lateral aspect of the thigh, our landmark here is the sciatic nerve. If we move with the sciatic nerve, the muscle which will be examined or seen in the view is the biceps femoris muscle, long head and short head. If we move at the medial aspect of the tuning fork medial arm, we see the semitendinosus and semimembranosus muscle. Here we start at the handle of the tuning fork, which is the site of the ischial tuberosity by TS and LS examination. Putting the probe at the ischial tuberosity, we can see here the hamstring tendons. The one at the lateral aspect is the common tendon, and the one at the medial aspect is the semimembranosus tendon. Actually, by the sound, it's very difficult to differentiate both two, but we just know the location of each tendon. Here is the sciatic nerve. This is an LS examination of the tendons at their insertion. Here is an MRI showing the common tendon, which corresponds here to this area, and the semimembranosus tendon, which corresponds here in the ultrasound, and the sciatic nerve as seen. Then if we move the probe downwards towards the curvature of the tuning fork, we will see the Mercedes-Benz sign of the sciatic nerve and the semimembranosus tendon. This is the Mercedes-Benz sign, and this is the semimembranosus tendon. This is the semitendinosus muscle, the biceps femoris, and the adductor magnus. If we put the probe LS above the sciatic nerve, what we will see is the biceps femoris muscle, and below it the adductor magnus muscle. If we put the probe LS over the semimembranosus tendon, we will see the semitendinosus muscle and the adductor magnus. Then if we move downwards along the medial arm of the tuning fork, our landmark will be the semimembranosus tendon. Then we'll move at the medial aspect. What we'll see the semitendinosus muscle and the adductor magnus. While moving downwards, the semimembranosus muscle will start to appear, and if we go further downwards, the semitendinosus muscle and the semimembranosus muscle are noted with the increased bulk of the semimembranosus muscle. And as we go downwards, we'll see the main bulk of the semimembranosus muscle and the decrease in bulk of the semitendinosus muscle. This is a panoramic view of the distal medial aspect of the thigh, of the posterior thigh, or we can see here the semitendinosus muscle, the semimembranosus muscle, the gracilis, sartorius, and the vastus medialis. Then if we go downwards and we choose to go with the lateral arm of the tuning fork, our landmark would be the sciatic nerve at the site of the Mercedes-Benz sign. That is the biceps femoris long head, semitendinosus tendon. So on moving at the lateral aspect, the only muscle seen at this area is the biceps femoris muscle, the long head, and the short head. As we move downwards, here the short head starts to appear. Then these are the two heads. The medial one is the long head, and the lateral one is the short head of the biceps femoris muscle. Thank you very much.